Good afternoon, Mikhail. How are you doing today?
Oh, I'm doing so well, Dr. Carr. It's so wonderful to be chatting with you today.
Thank you. It's the heat is like killing.
Well, it's a pleasant or a different experience, I guess, here in Calgary where we live, because although it does get hot sometimes, we've had heat for about a week and we're not used to that.
I know. Anyway, moving forward, I know you love the heat because you miss South Africa. I can't say I love the heat at all.
Yeah.
So that's the reason we are doing an audio only today. It's really so hot. Uh, what are we talking about today, Mikhail?
So today you and I were having some interesting discussions, and you had sent me um, an article which really we needed to delve into a little bit about the impact of fructose on your health. Right, fructose is what makes fruit so sweet. Fructose is many more times sweeter than sucrose, which is what we know as sugar, and fructose is also not metabolized in the blood the same way that sucrose is. So, people often um, are misguided as to whether it is healthful or not. And it was definitely worth us sharing some information with people today, I thought.
Thank you, Mikhail. So, the most important questions that Mikhail and I will attempt to answer today is number one, how much fruit should you eat as a part of a healthy diet? And the second part, which we will probably not get enough time to delve in details, is why is fructose such a big problem in relation to insulin resistance, high blood pressure, higher risk for heart disease, stroke, and what is the context of fruit and how much should you have? And most importantly, the other big thing is now usually, so Mikhail, this reminds me, a few years ago I was speaking at an event in Mumbai, and here I was pontificating about eating real food and not food like substances. And after maybe a few minutes after that, I said, fruit is nature's candy. So one lady gets up and says, just now you said we should eat, real food. And now you're saying that, you should not eat too much of fruit. I said, well, thank you for calling me out on what I said. So then I explained, so what is fruit and, everything in context. So that was interesting, something I remembered when when I was talking to you about this particular podcast episode. So how much of fruit is, because we are all told you need to eat lots of fruit and vegetable, whereas you and I say you need to eat vegetable and fruit and prioritize protein before that. So how much of fruit is right for you, and what are the problems because of? So the other important question, I'm digressing, is fructose from things like high fructose corn syrup, then sugar sweetened beverages, fruit juices, is it the same as getting fructose from whole fruits? That is the other important question. And so, Mikhail, first I'll hand over to you to explain what is sucrose and what is fructose. As you rightly pointed out, fructose is metabolized very differently by the body. And that is probably the biggest problem, because sometimes people don't understand that. So, Mikhail, will you just explain very briefly? Sucrose is table sugar, and how much of fructose is there in it? And when we talk about high fructose corn syrup, what is the difference, and what is it that makes, everyone talks about high fructose corn syrup is killing you and all those things.
Okay, so sucrose, which everybody would know as white table sugar or just table sugar, even brown sugar, any sugar, right? Sugar is the scientific name is sucrose, and it is comprised of 50% glucose and 50% fructose. The glucose gets metabolized in your bloodstream. The glucose becomes your blood glucose. The fructose is metabolized in the liver slightly differently from the glucose. So that's sucrose. Now, remember in the beginning, I had said that fructose is significantly sweeter than sucrose, right? Fructose is what makes sugar sweet. So food manufacturers have found a way to to make a sweetener that increases the fructose content, not a lot, and to decrease the glucose content, and it makes the product much sweeter. So therefore, you can use less of it. So theoretically, use less of it. So high fructose corn syrup has 55% fructose and 45% glucose. Now, generally, that probably doesn't sound like a lot to people, but if you read the ingredients in any packaged food, you will find that there is sweetener in everything, and it'll be labeled as corn syrup, not necessarily high fructose corn syrup. It'll just be labeled as corn syrup because they make sugar from corn. And they make this high fructose corn syrup product again from corn. So when people tell us that corn is a vegetable, Dr. Carr, you and I often laugh. Corn is actually a grain, and corn is very, very high in both fructose and glucose. The glucose actually makes it starchy, and the fructose makes it sweet, which is why sweet corn is so sweet. And we've been hybridizing it for centuries to make it even sweeter. So you will see it in absolutely, absolutely everything. So when you are consuming almost every single food in a standard Western diet that's containing just a teeny tiny little bit more fructose than glucose, cumulatively, you end up eating a lot more fructose than glucose. It's not in an equal balance anymore. And that, from a health perspective, can be very problematic. And it's not to say that sucrose on its own is not problematic. It is. But high fructose corn syrup presents its own set of problems because that fructose is not metabolized in the bloodstream. It's metabolized in the liver, and the liver is very busy doing many, many other tasks. So metabolizing the fructose and metabolizing this extra and this cumulative extra fructose puts a huge burden on the liver and actually creates a situation where we start to store fat around the liver, non-alcoholic fatty liver disease. Dr. Carr, did you want to add anything in there?
Yes, I did want to add quite a few things in that. So one of the biggest problems with fructose is, I call it the stealth bomber, because we talk about sugar being harmful. Of course, sugar is harmful, definitely, and half of sugar, sucrose, is fructose. Few things I wanted to highlight. Another thing is honey. Now, honey is natural, but the fact is, a lot of people think that, if they give up sugar, they can just add honey to their tea. Now, honey is 40% fructose. And I have to keep reminding people, honey, jaggery, agave. Agave, I think, has more fructose, right, Mikhail?
Agave is 100% fructose. So out of everything that you could consume that is, and I say it in air quotes, natural, I tell people to avoid agave syrup like the plague. Honey is 50-50 still.
Yeah. So
agave is 100% fructose.
Yeah. And the problem is, see, when people had used honey in the past, it was always very small quantities. Honey didn't come in bottles, honey came from a beehive, which was it was quite a process to get that. So yes, honey, jaggery, agave, sugar, all of them, the fructose part of it is another big problem in addition to the sugar. So what fructose does is, that is where the metabolism comes into the picture. And as you rightly pointed out, Mikhail, most of it is metabolized in the liver. Some part is in the kidney and also the intestines. So the kidney component of it is extremely important. I'm coming to that, because we are talking about, fructose and fruit intake in the context of insulin resistance, pre-diabetes, high blood pressure, risk for heart disease, in that context. So fructose goes directly into the liver, causes mayhem there, and but it does not raise blood sugar or insulin. So there was a time when people used to say, okay, people with diabetes can have fruit sugar because it doesn't raise your blood glucose levels. But then at that time, there wasn't a lot of awareness about, what it does in the liver. So that is one thing. So fructose causes mayhem in the liver. The second important thing is, fructose raises levels of uric acid. Now, when anyone talks about uric acid, very often they think that, oh, high uric acid means gout. So importantly, everyone who has high uric acid may not have gout, but high uric acid levels are associated with high blood pressure. They're associated with worse outcome in there. It's a risk factor for heart disease. It's so bottom line, it's also a problem in chronic kidney disease. So if someone has early kidney dysfunction from diabetes, maintaining normal uric acid levels is extremely important. And this episode is not about uric acid. We'll do a separate one on that, because what is a normal uric acid level? But interestingly, so obviously, as a clinician, Mikhail, the question is, okay, if high uric acid levels are bad, does lowering uric acid help? So yes, the answer is yes. So lowering uric acid has helped in reducing blood pressure, almost works like another antihypertensive medication. So uric acid is extremely important for that. And of course, as I mentioned about kidney disease. So these are the reasons where, and the other interesting factor is our bodies have the ability to make fructose in the liver through, there's an enzyme called fructokinase, all those things. But in relation to the metabolism of fructose, one thing I wanted to, because a lot of the problems that fructose causes is because of, one is uric acid, second is it uses up a lot of ATP. Now, ATP is the cell's energy system. So you don't want your ATP going low, because that is related to lower energy in the cells and overall lower energy levels as well. And it also causes problems of oxidative stress, increasing inflammation. And another big thing that fructose does is increases, lipopolysaccharides, so endotoxemia. And I think this is becoming too technical now, but bottom line is fructose doesn't cause just one problem, it causes multiple problems. And the most important message that I would like to give is, now fructose has been associated with every feature of metabolic syndrome. So metabolic syndrome is a condition which is essentially an insulin resistance problem where the hormone insulin doesn't function the way it should. So what are the features of metabolic syndrome? It's high blood pressure, low HDL, so that is supposed to be the air quotes good cholesterol, high triglycerides, hypertension, belly fat. So all these are features of metabolic syndrome, which is essentially insulin resistance. And the worst possible thing is fructose is associated with worse non-alcoholic fatty liver disease. So Mikhail, last year actually there was a proposal to name, uh, I think it was 2019 anyway, to name non-alcoholic fatty liver disease. So NAFLD-NASH is what most people know it as, to call it metabolic, metabolic abnormality of the liver. So it's MAFLD, M instead of N, because when you call something non-alcoholic, there are people who, they'll think that, okay, I'm like, alcohol is not the problem for it. And we do know that alcohol is not your friend for anything. And I am here, Michal, you don't drink, I know, but I love red wine, so I have to my disclaimers should be in place. So I think that is a much better way to look at, because unfortunately, Michal, this is what I have seen. Many people don't associate their insulin resistance or even their diabetes with fatty liver. So anyway, after a lot of digression, going back to fructose. So fructose is bad for your liver, bad for your blood pressure, bad for your diabetes, bad for your kidneys. So what else, Mikhail? Anything else to add to that?
Well, we do know that in conventional medicine, people were often told to consume more fructose because it didn't have a direct impact on their blood sugar.
Mm-hmm.
And I do need to emphasize that as you've described, it will still impact your diabetes, maybe not in the direct way that we've been told, but in a more insidious, indirect way that is probably much more inflammatory because you can't see it.
Exactly. So that is the concern, because you can check your blood glucose levels, but you have no way of checking the fat levels in your liver on an everyday basis. So you don't know the mayhem it's causing in the liver, and that is one of the big ones. So, Mikhail, where does most of the fructose in people's diet come from?
So, as I explained earlier, for people who are not following our recommended diet, the majority of the fructose that they're getting comes from high fructose corn syrup, which is in everything. Everything that you would eat that comes in a package, check the ingredients, everything. It's in ketchup, it's in cereal, it's in bread, it's in salad dressings, it's in any packaged good that you would ever get. You will find this, you will find corn syrup of some type in there. And that they label it a whole bunch of different things, but it is in everything. And I often I've asked some of my clients to start checking, when they start to check the ingredients in the foods that they eat, and where are the most surprising places that they find that the sweetener hides. And it is literally in everything, even the most savory of not sweet tasting things. It has fructose, it has corn syrup in it, which we know in modern times is high fructose corn syrup. So if you are eating a diet that contains any processed food whatsoever, that is where the majority of your fructose is coming, not from the fruit that you're eating. Also, if you drink or if you give your children a lot of fruit juice is terribly high in fructose itself because it is the concentrated sweetener from a fruit. And we often drink much more juice than we ever would eat that amount of fruit, right? One apple probably gives you about maybe 80 milliliters of apple juice. And who drinks 80 milliliters of apple juice? We'll drink 250 or 300 milliliters of apple juice. Those little boxes of apple juice that they give to kids are 125 milliliters of apple juice. And, they can have 2 or 3 of them quite easily. And that's a lot of fructose.
Yeah, thank you, Mikhail. That's a very important one, because when fructose is in a liquid format, it is much worse than when it is, as you pointed out, from fruit. And we'll talk about what else is there in the fruit, the fiber and all the other benefits. So liquid gets, number one, as you said, fructose gets absorbed much faster. So in a liquid format, it would definitely get absorbed much faster. So a lot of people, Mikhail, still think that fruit juice is a healthy drink. And sometimes I've had to tell people, yes, we know all the problems with alcohol, but what if you're drinking 3 glasses of juice, you're probably better off drinking a glass of wine than the juice. So that's a big one. Another big one is all these sugar sweetened beverages, like in India we call them cold drinks. That's another big one. And amongst regular, so Mikhail, one more question I wanted to ask is, how, when someone's reading a label, what are some of the possible names that fructose would come under?
Well, corn syrup is the big one. You'll see it
Okay.
as corn syrup. That's probably the biggest one. I mean, sugar has 56 different names.
Hmm.
There's a lot that you could. There's many ways that they name it, and they will use more than one variation of it so that you think that there's less sugar, because we've all been told now, because we're all very educated, that if it's one of the first 3 ingredients, then don't have it, because then that's where the majority of it comes from. But that isn't the case anymore, because what happens is that they just use it in different names. We can post a list of all the different names for sugar if
Okay,
you.
thank you. So it will be there in the show notes,
Yeah.
the names of sugar, of fructose and the other problem, Mikhail, is, nutrition labels in every country is not the same. Maybe in Canada and US, it's a little more detailed. In India, I don't remember seeing very detailed nutrition labels. So That is the reason, we always talk about don't eat stuff in boxes and bags, and things like that. But then unfortunately, even things like, rice or stuff like that, or lentils, they also come in boxes and bags. So basically, real food, not food like substances, is the important one. Then, Mikhail, from the natural sources of fructose, what are some of the ones that people think are healthy, but are actually not healthy in terms of fructose at all?
Well, agave.
Hmm.
Agave is, people think that agave is a healthy alternative to sugar. It's worse.
Hmm. Yeah,
So,
it's like if it's 100% fructose, then definitely.
yeah,
And some more which are probably more popular in India are dry fruit. So
right.
dates, dried raisins, all those are really big ones. And anything else which people think are healthy but are not really.
Fruit juice, anything that's sweetened with fruit. Uh,
Hmm.
you'll see a lot of beverages that say no added sugar. They're
Yep.
sweetened with fruit juice. So,
Okay.
kids little gummy sweets sometimes, or not always for kids, but you'll see naturally sweetened with fruit juice.
Hmm.
Yeah, it's fructose.
Yeah, and gummies are like they are my kryptonite. So I was recently wearing a continuous blood glucose monitor, and this was curcumin gummies. Okay, so people would think curcumin, like I'm getting a huge dose of curcumin from having gummies. My blood glucose, and I don't have diabetes. My blood glucose levels went up to, I think it was 7.8 or something. Or about 8, I forget, but this was like one of the highest spikes I had, even more than potatoes. So
Ginger,
anyway.
ginger gummies are the same. A lot of people chew on ginger gummies.
Hmm.
They hear that ginger is very good for digestion. Ginger can help with your blood pressure as well. But those ginger gummies, full of fructose.
And gummies in general have a lot of stuff in them which are definitely not desirable. So anyway, and people give gummies to children. As some of the nutritional supplements are in gummy forms. Anyway, we are digressing. So the next thing comes
Mhm.
is okay. Let us say you're somebody who eats very healthy. You don't eat any of these processed stuff. You don't eat sugar sweetened beverages. You don't eat fruit juice,
Mhm.
but you do have a fruit smoothie in the morning. So, Mikhail, what would you say about that?
Well, again, everything is very individual, and the thing that I want to start with is that, from an evolutionary perspective, fruit was not available all the time, all year round. Now
Yeah.
we can go down to the grocery store, to the supermarket, and buy any fruit that we want any time of the year. Here in Canada, where you and I live, we can get mangoes in December.
Oh, yeah. Absolutely.
So this is an evolutionary mismatch, and we do know that we process carbohydrate, we process sugar, and that would be fructose and glucose better, especially fructose. We process it and metabolize it better in the summertime, in the summer months when it's sunny outside. And that was when fruit was evolutionarily available to us, was in the late summer. And
Yeah.
often it would be available. We would eat it all because it was delicious. We have a drive to like sugar, right? It is
Yeah.
delicious. And we would gorge on the fruit. But then after the summer comes winter.
Hmm.
In winter, there is not a lot of food always, or the dry season, depending on where you live. There is always a season, no matter where you live on the planet, where fruit is less abundant. And that is the time where all of the fat that we stored from eating all of that sugar got metabolized and used. And we live in a world right now where there is no food winter. We can get
Hmm.
whatever we want, but we still have that evolutionary drive to enjoy the sweet. And we have Western medicine, we have these nutritional guidelines telling us that fruits and vegetables are the same,
Yeah.
which they are not. So understanding this is why you could turn around and say fruit is nature's candy, because people will often tell me, "Oh, I'm not addicted to sugar, but I eat fruit morning, noon, and night." So
Yeah.
not ideal. And in our modern world, if you find yourself reaching for large amounts of fruits and you are metabolically unhealthy, or you are looking to drop some weight, that is not ideal. starting the morning off with a sugar bomb,
Mhm.
literally, is a smoothie made with probably more than one or two fruits, because when you blend them up, it blends up into a small amount, right? We often put in a banana and some blueberries and some strawberries and this and that. Uh,
Yeah.
Maybe we put in some protein, maybe we don't. Maybe we put in some fat, maybe we don't. Is not the best way to start your day. And you and I have spoken about starting your day with an insulin spike or a sugar bomb. And just because it comes from a natural source doesn't make it any less of a sugar bomb, right?
Yeah.
It's still going to impact your insulin. It's going to impact your health in a great way. So the one thing that I like to stress to people is that everything, there is a place for almost everything in the diet. It's the poison is in the dose. And as natural and as healthy as fruit can be, when you're consuming it constantly and consistently, especially at the expense of other more nutrient dense foods, because fruit has some vitamins and minerals in it, but it has a lot more fructose than it has anything else, and sucrose, and it'll create more cravings. The poison is in the dose. If you're eating that at the expense of other things, you should probably cut back.
Yeah, thank you, Mikhail. And that is the problem with, giving generic recommendations about any food. Like someone asks Mikhail or me, do you think I should eat this? And if they are not a patient, we don't know the history, I always have to tell them, I don't know. I cannot give you some recommendations based on like off the cuff. Yes, just have a lot of, I don't know, whatever, whatever they're asking me about. So everything is in context. So if you are number one, if you are metabolically healthy, and Mikhail, I don't meet metabolically healthy people because obviously they don't come to me. But at the same time, I also see amongst my friends and relatives, most of them are not my patients, that none of them are metabolically healthy. So most of them would have some belly fat, or I know from conversations that they have hypertension, they have diabetes, they have high cholesterol, which they consider as a disease. Anyway, more about that later. So how many people are metabolically healthy? I'm not so sure, including children, Mikhail. That is the sad thing. Like every time I go to India, I feel the kids I see who are running around in our, in our condo, they seem to be, less healthy than I saw them the previous year. So very sad things. But anyway, now everything is in context. So if you are eating a ton of fruit and you're not eating enough protein and you're not eating other stuff, then of course it's not going to, be the best food for you, depending on what else is going on in your body. Versus, let us say you eat a small amount of fruit, but as a part of, like, at the end of a meal, it's like a dessert. Instead of having an ice cream or something else, you're having it, as I said, in its nature's candy. And that those are not my words, this is Dr. Eric Westman. So I must, Mikhail, I should have actually thanked two people, and I don't even know them personally. One is Dr. Peter Attia, and the other one is Dr. Richard Johnson, whom he interviewed on a podcast. I was not so aware about fructose causing, high uric acid levels. So that is a big one. Uric acid is so big for, hypertension, kidney problem, cardiovascular disease. And interestingly, Mikhail, I meet a lot of people with high uric acids, and all of them have been told by the doctor that they need to reduce their protein intake. But I haven't met anyone, not of course people who come to you or me, or one of the functional medicine doctors, who've been told that you need to get off the fructose more than the protein, more than the meat. So do you meet such people as well, Mikhail?
Well, it's interesting because I have a few friends and colleagues who struggle with gout, which
Hmm.
which is a condition associated with high uric acid. And it's interesting because they avoid animal protein like the plague. They avoid red meat, yet they consume loads of fruit.
Yep, fruit is healthy.
And there's no, the so it's interesting because in the presence of a diet that's high in fructose, the meat will trigger the gout. But if
Oh
you
yeah,
take
yeah.
fructose away, then the meat has no impact on the gout. And this is such a tough concept for these people to understand, because we've grown up in this environment of symptom management of symptom. We're not looking at the cause of the symptom, right? So
Exactly.
it's just anyway. Again, I'm going down a rabbit hole, but I'm just digressing. It's always an interesting observation.
Yeah, you brought up something so interesting, but like you rightly pointed out, we'll go down another rabbit hole. So, again, it's a problem of high salt, high sugar. If that is what you're eating, that is the worst possible thing, and high carbohydrate with that. So, that is the worst possible combination. So, another, and this is from Dr. Johnson's work, he talks about probably some of the problems with high sodium diet and, the long term impact on them, on health is probably related to this problem of of fructose more than anything else. But anyway, that is for another conversation. But yes, in the context of high salt, high fructose, high amount of processed food, high carbohydrates, definitely it's a very different story about how much fruit you should eat. So the next question is, Mikhail, so does fructose from fruit versus fructose from all this other stuff, the liquids, the fruit juice, the sugar sweetened beverages, is there a difference in the impact between the two? And are there studies looking at that? So Mikhail, first I'll let you respond to that, then I'm going to quote just one study, not too many.
Well, you and I discussed this earlier in the podcast, Dr. Carr, because we know that the liquid forms of fructose are much more readily absorbed and metabolized than fructose that is combined with fiber specifically, and also some other vitamins and minerals. So so we know that fructose in products, first of all, is unnatural. Our bodies are incredibly smart, and they know when something is in balance and when something is not. And when it is not, we often look to metabolize it quicker at the expense of other things. And you and I have spoken about oxidative priority before. Mm-hmm. And what happens with unnatural substances that the body has to deal with first, long before it deals with anything that it knows. So just something to be aware of. We know that liquid fructose has a much greater impact on the metabolism than fructose in fruit. And yes, there are studies, and I know you will talk about that. Fruit also comes combined with vitamins, minerals, and fiber, and fruit in its whole form has a much greater impact on our satiety. So when you're drinking something, liquid calories, the body does not register as food. So if you're drinking your high fructose corn syrup sweetened beverage, you're not even registering that you're taking calories into your body. And again, the ability to overconsume is much higher. Even if you are eating loads and loads of fruit every single day, there is only so much you can eat before things start to go awry in your body, or you don't feel good, or you feel nauseous, or you don't want to eat anymore, or it affects your bowel movements. But the same isn't true when you're drinking it. So I think that's a good place for you to bring in the studies.
Okay, thank you, Mikhail. So this was a study, and I'll post the link in the podcast notes, where they looked at low fructose and from diet as well as natural fruit supplements. So what they found is, and they were looking at weight loss. So obviously this was a calorie restricted diet. So what they found is those who were in the low fructose group, and the low fructose group was like as low as 10 grams of, I think it was 10 grams of fructose a day. The other unfortunate thing is most of these studies are food frequency questionnaire, and as we know that they are not the best data, but we don't have any more data than that now. So the low fructose was 10 grams of 10 grams or 10 milligrams, was it, Mikhail? I think I'm getting it mixed up.
You know what? Honestly, Dr. Carr, I do not remember.
Okay, so bottom line is just in context of 10, and the higher, the moderate natural fructose group. So the natural fructose, meaning the ones who got from fruit, they were in the range of 50 to 70. So that is one this thing. What they found is the lower fructose group did not lose as much weight as the moderate fructose group. Now, the moderate fructose group is the one who are on fruit. But what is interesting is, now both of them lost weight because this was isocaloric, meaning calorie count was the same. What they found is to maintain that strict calorie intake, Those who were on the low fructose group, who did not lose as much weight as the moderate fructose group, actually were eating more carbohydrates because otherwise they couldn't compensate for the calories. Number one. Number two, which is extremely interesting, is that now blood pressure was reduced in both the groups, the low fructose and the natural moderate fructose groups, and body weight, of course, was reduced because they were on a lower calorie diet. But what they found is those who were on the the low fructose group, not the natural fruit one, the other one, their blood pressure, systolic blood pressure, went down even more, though it was not statistically significant because of the number of people on the study. So this is very interesting because yes, weight loss itself reduces blood pressure, but at the same time, those who are eating more fruit, at least in this particular study, did not reduce their blood pressure as much as the ones who were eating even less fructose. So that is something I found very interesting and just wanted to highlight. So, in conclusion, Mikhail, what would you, what are the few messages that you want, people to focus upon?
Okay, so fruit is okay to consume, and I hate the word moderation, and I can really say,
Yeah. Yes,
but
I do too.
I would say in limited quantities. If
Mhm.
you are looking to drop weight, or if you are struggling with type 2 diabetes, or you've been told you have pre-diabetes, or if you have any other chronic health condition, I would limit my fruit to a maximum of one fruit or 1 cup of fruit, like cut up pieces of fruit a day. That's it. For a normal, healthy individual, I would keep it to 2 or 3 of the same amounts, only because fruit can take the place of other more nutrient dense foods in our diet. So it's a very general recommendation, but I think that's safe and that's fair, and that allows people to still enjoy some fruit, whether they are metabolically healthy or not, and still learn how to limit it, how to rather have vegetables as opposed to fruit, or not sweet fruits as opposed to sweet fruits. Now, there are fruits that are lower in sugar, and that is generally all of your berries. So again, if you're looking to reduce weight or are metabolically unhealthy, struggling with type 2 diabetes, pre-diabetes, or any chronic health condition, berries are best. It's not to say you can't have anything else, but stick to berries. Berries are best. And you don't need fruit in order to be healthy.
Mm-hmm. So the other important thing is, Mikhail, I wanted to bring up is when we talk about getting, so what this study said, this was the hypothesis that those who ate fruit and still lost weight, though they didn't talk about the blood pressure because it wasn't of statistical significance, they said that it is possible because it was higher in vitamin C and probably antioxidants. But you and I know that you are not going to get a ton of antioxidants or vitamin C from eating just a small amount of fruit. So relying on only your fruit intake for the antioxidants is not, in my opinion, not the best strategy. That is number one. Number two is, Mikhail, what would you say are some of the highest fructose containing fruit, which one of them is like a great favorite with a lot of people?
So tropical fruits. So if you're looking at the really, really sweet fruits, so ripe bananas are one that are just people know about. Mangoes, papayas, pineapples. Think of the tropical fruits that
Grapes.
tend to be the worst. Grapes are quite high as well. Surprisingly, and this is just an absolute side note, people think that cherries are very high in fructose. They're not. And cherries are actually, and I'm not saying eat more than what I recommended, but cherries are good for reducing uric acid, which is, they have a compound in them. But that's just an absolute side note conversation. Stone fruits tend to be better than fruits that have multiple seeds, other than berries, which have multiple seeds. But I'm thinking like a peach is probably a better option, believe it or not, than an apple. But it's the tropical fruits and the grapes and some of the deciduous fruits that tend to be the highest.
Thank you. So, Mikhail, I'll share my cherry experience with you. Now, I don't have gout. I don't have high uric acid either. So, recently, like I said, I was wearing a continuous blood glucose monitor, and these lovely BC cherries. And this is when I thought, they need to sell them in smaller packs. So this is the usual standard bag. You know how much it is. It is quite a lot, and I'm the only one who likes cherries in my house. So I got that, and it was there on the dining table. And you know what happens each time I cross, here and there, I'm just picking up a few and eating them. And oh my God, my blood glucose went really high. Not as high as the gummies. I think it was about 7.5 or something. I don't remember the exact number, but it was way higher than what it usually is. So, yes, maybe yes, there are studies supporting where people, when they eat cherries, it helps their gout symptoms to reduce. But you have to be careful. If you're someone like me, it might help your gout, but again, I don't have gout. It might help your gout, but it might raise your blood glucose levels. So like I always say, Michal and I can never give simple answers. So it's different for each one of you, and that's why generic recommendations are so difficult to give. Up to a certain point we can, but beyond that it's difficult. So that was the important one. So the high fructose fruit are what Michal mentioned. What else would you like to add, Michal? And then I'll just conclude with my comments.
Add to that high fructose fruit, what I was talking about. And this is just in my experience with my clients. I have found that sticking to my recommended limits for fruit consumption is much more impactful than worrying about the type of fruit. So I have found, and this, as I said, this is just in the experience with my clients, is that if people really enjoy some high fructose fruit, and it's a seasonal thing, so in the summer, or let's say you go on vacation to Hawaii and you want to have some pineapple as your fruit, I find that much less of a problem than just going nuts, let's say, on peaches and having 12 peaches during the day. So everything is contextual and everything is personal. So, we're not saying eat this fruit and not that fruit. I'm saying look at your fruit consumption and understand evolutionarily where it's coming from, and be mindful of it, and where your health status is and where you want it to be, and be mindful of it from there.
Thank you, Michal. And to that, I'd like to add, don't drink your fruit. That is very important. And the other important thing is I talked about uric acid, because high uric acid is, again, there are prescription medications to lower it. But as Michal and I, we call ourselves like we are the upstream folks. So my point is, if I can fix something upstream, why would I look at medicines first? So how I approach it is, again, Michael, the type of people who come to us are the ones who don't want a lot of prescription medications. So they are always open to trying out something which is more, natural. So number one recommendation I give to people when they have high uric acid, whether they have gout or they don't have gout, is look at your fructose consumption, reduce your fructose consumption from whatever it is now, if it is high. And the next thing is, it is important to get your uric acid levels lower, because it impacts so many other areas. And bottom line is, fructose is associated with every possible bad thing which is a component of metabolic syndrome. So fatty liver, high triglycerides, high blood pressure, low HDL, and belly fat. Everything is associated with fructose. The problem is it will not raise your blood glucose levels or your insulin levels, so you don't realize how harmful it is. Thank you, Michal. Thank you for joining me today.
Thanks so much, Dr. Katz. Always a pleasure. I look forward to chatting more soon.
Okay.
Bye now.
Bye now.